Today on The Explainer, we're solving a medical mystery that just might hit close to home.
You know that nagging low back pain? Well, could it actually be coming from your hip?
Honestly, figuring out the real source of the pain is a puzzle, even for doctors.
That's because the pain from your hip can feel like it's in the exact same spots as pain from your spine.
So how do we solve this thing? Let's look at the key concept that connects them.
It's called hip-spine syndrome. It's basically a framework for understanding this whole connection.
And this connection can cause trouble in three main ways that researchers have identified.
You've got simple, one clear cause, complex, where both are to blame, and secondary, where one problem creates another.
Now that complex connection, it gives us a really surprising clue about what's really going on.
And get this, treating the hip can often make the back pain simply disappear.
In one big study, over 58% of patients said their back pain got better after hip surgery.
And for those with severe back pain, a whopping 80% saw an improvement. Wow.
So why does this happen? The answer really comes down to one thing: movement.
Let's look at a super clear example from research: a surgically fused or locked hip. For these patients, low back pain is the #1 reason they get another surgery.
And that tells us everything. If the hip can't move, the spine is forced to overcompensate.
See, in normal movement, they're a team. But with a stiff hip, the spine does all the extra work.
And studies consistently link back pain to things like less hip motion and just poor movement patterns. So, after all this detective work, what's the big takeaway here for you?
First, where you feel the pain isn't always where the problem is. A full exam is absolutely key.
It's also about realizing how you move is crucial, because your whole body is one big interconnected team.
So it leaves us with one question. Is it time to look at the bigger picture of your pain?